Now, in this tutorial, we are going to continue with the pathogenesis of the birth asphyxia based on fetal abnormalities. Now, we need to know that what? You need to know that these pathogenesis are based on any disease of the fetus that may result to an inability of the child to sustain and to initiate and sustain breathing. Is it clear? So there are diseases that may result to the child inability to sustain and to initiate and sustain breathing. Is it clear? And what are those diseases? Generally, the diseases are going to be on the respiratory system, you have disease on the cardiovascular system, and you have also diseases associated with labor. Is it clear? So those are the different elements that you have to understand, which can result still to birth asphyxia. Is it clear? So the next thing, you need to know that on the respiratory system, the diseases are treated in the respiratory system. What are the diseases in the respiratory system? You need to know that you have elements like acute respiratory distress syndrome. Is it clear? Acute respiratory distress syndrome is when there is a lack of the type 2 pneumocyte, and mostly this occur when the child was born less than when the child was born less than 28 weeks of gestation. Is it clear? Because you need to know that what by 28 weeks of gestation there is complete formation of the type 2 pneumocytes. Is it clear? But by 34 weeks of gestation, there is complete formation of the type 1 pneumocyte. That's what you have to understand. Is it clear? 28 weeks gestation, we have complete formation of the type 2 pneumocyte, and 34 weeks gestation, we have complete formation of the type 1 pneumocyte. What does it mean? It means that if a child is less than 20 weeks of gestation, there is no production of surfactants. There is not enough production of surfactants. So what is going to happen is that there is going to be easy lung collapse. Is it clear? And when the lung is collapsed, it's just like when the lung is collapsed, it is difficult to expand it again except you have surfactant. So in this case, when you have extreme prematurity, it is best to manage it with surfactant. Is it clear? Now, when you are 28 to 34 weeks of gestation, you have always the production of surfactant, but what is the problem now is a type 1 pneumocytes, meaning that the one that are producing the alveoli, the formation of the alveoli is not yet complete. Is it clear? That complete production of the alveoli is going to stop by 34 weeks of gestation. And between 28 weeks to 34 weeks of gestation, you don't need again to produce, you don't need again to give surfactant to the child. Is it clear? Because by this time, it is thought that the child is going to have already surfactant. Is it clear? So acute respiratory distress syndrome is associated with the type 2 pneumocyte because they produce surfactant and may result to the collapse of the lungs. Other pathology that we can have here affecting the respiratory system, we have the pulmonary hypertension. Is it clear? Pulmonary hypertension can also be associated pathology here. The next pathology, we have cystic fibrosis. Though cystic fibrosis is not going to present at this age, cystic fibrosis will always present later, so I'm not going to call it here. Is it clear? We have also pulmonary hypoplasia. Pulmonary hypoplasia, which may be as a result of any congenital abnormality. Is it clear? So those are the different things that you have to visualize. Now, for the cardiovascular system, you need to know that here you are going to speak about the congenital heart diseases. Is it clear? The congenital heart diseases. And when speaking about congenital heart diseases, you need to know that you have to divide congenital heart disease into two. Generally, congenital heart diseases are divided into two. You're going to have cyanotic congenital heart disease, cyanotic congenital heart disease, and you have acyanotic congenital heart disease. Is it clear? In cyanotic congenital heart disease, they are generally having the T's. The first one, you're going to have tetralogy of Fallot. Is it clear? Tetralogy of Fallot. And tetralogy of Fallot is made up of a tetrad of 4 elements. The first element in tetralogy of Fallot is that you're going to have an overriding aorta. Is it clear? The second element is the pulmonary stenosis. Is it clear? Pulmonary stenosis. The third element is going to be ventricular septal defect, and the fourth element is a right ventricular hypertrophy. So those are the four elements. One, the major element in the etiology of Fallot are pulmonary stenosis and ventricular septal defect. So if you want to answer a question in the exam, first start by these two. Now, after cyanotic, the second point inside cyanotic congenital heart disease, in the next year we have tricuspid atresia. Is it clear? Tricuspid atresia is also actually a cyanotic congenital heart disease. You have a truncus arteriosus. Truncus arteriosus, meaning that the pulmonary artery and the aortic aorta did not divide. Is it clear? They have a truncus in common. Now, the fourth one is a total anomalous venous return. Total anomalous venous return. Is it clear? Meaning that the blood that was supposed to be returning into the right atrium is instead returning in the left atrium. That's a total anomalous venous return. Is it clear? Now, the fifth one is transposition of the great vessels. In transposition of the great vessels, instead, the blood that is supposed to come out from the right atrium, from the right ventricle, is instead coming out from the left ventricle, meaning that the aorta is coming out from the right ventricle and the pulmonary arch is coming from the left ventricle. So that's transposition of great vessels. Is it clear? And we have a common right and left ventricle. Is it clear? So when we have also a common right and left ventricle, meaning that the right and left ventricle are fused. Is it clear? I think that is called a conus arteriosus. Is it clear? Conus arteriosus. So those are the different elements that are associated with cyanotic congenital heart disease, and they are the one that can be associated with when the child is directly born. You see elements of birth asphyxia. Is it clear? Now, for a cyanotic congenital heart disease, the first one you have a ventricular septal defect. The second one you have atrial septal defect. The third one you have a patent ductus arteriosus. But you need to know that what the cyanotic congenital heart disease, can convert to cyanotic congenital heart disease later in life. Is it clear? And they convert from a cyanotic to cyanotic when there is a syndrome called the Eisenmenger syndrome. Is it clear? When there is a syndrome called the Eisenmenger syndrome, and the Eisenmenger syndrome occurs with why? Because normally when you have your heart, is it clear? And there is a right ventricle, right atrium here, the left atrium here, the right ventricle here, and the left ventricle here.